Hi, my name is Tori Johnson, and today I'm going to be demonstrating an IV skill. I'll make sure throughout this entire skill that I'm following all GPSP guidelines, all the 11 rights to myself and my patient, and following all 3 med checks. So I would knock, enter my patient's room, perform hand hygiene, and at this time I would introduce myself to my patient, get their 2 identifiers, which are name and date of birth. Those match the wristband. I would then educate and explain the procedure to my patient, that we are inserting an IV for normal saline, and at this time I would ask any question or answer any questions that my patient had. I would also assess for allergies, assess for any pain, irritation, anything like that that I would need to know before performing an IV. Okay, so let's get started. All right, I'm gonna grab hand hygiene, put on gloves.
After you get up, because you have one.
Okay, so I'm going to start with assessing my patient's IV site and finding the proper site for them. I'm going to go through palpate the vein, tourniquet, and I would also ask them about any complications or preference on which arm to do their IV on. Palpate, find that radial pulse. Found the good vein, there's no skin irritation, swelling, redness, scar tissue, anything like that. Okay. So then I'm going to make sure that I have all of my proper supplies. And this saline pouch is what was ordered. The packaging was not expired and has not been tampered with. Same thing with my tubing. It's all coming out of a fresh package. I'm going to make sure that while removing these, I'm maintaining a septic technique the entire time and not contaminating. To remove this cap and flush this line. There's no holes, bubbling, or kinks in the tubing. I'm going to scrub that hub with a clean alcohol pad, allow that time to dry, and replace that with a new clean cap. I'm going to close the tubing and make sure that this is half full. We're starting. Close that back off. Okay. I'm going to do my hand hygiene and replace my gloves. So I've already found my IV site, assessed my patient's skin, assessed their allergies, and identified them correctly. Okay, so now I'm going to reapply the tourniquet. Palpate that vein. Find that radial pulse. And clean my site. I'm gonna allow that time to dry. Actually, I lied. I'm gonna prime my J-loop first. So I removed that tourniquet.
No, you can't focus on stuff. while you're watching, dude, like,
Grab the hub. Allow time to dry.
I like you while I'm watching.
Grab the hub and allow time to dry. J-loop is primed. I'm not going to touch or contaminate this and put that back in the package. Okay, so now we're ready to start. Alright. Apply this tourniquet. Sorry, these gloves are a little bit big. Okay. And I had my finding that vein, palpating, radial pulse is still present. Turn it off and allow that time to air dry. I'm going to insert this with Bevel Up. Remove the tourniquet and hold that vein taut. Hit the safety and this will go in the sharps. And I'm making sure while I'm holding the IV catheter that I'm not touching the IV site. And I'm holding that taut. I would not let go of this at any point.
Did he kill his sister?
Take that down. My clean J loop. And I did assess that I had blood return on that. There does not appear to be any infiltration. Do my vein. I'm gonna flush this through. Pull back and make sure I get blood return once again. And then I would flush the rest of this 10 milliliter syringe. Let that sit. IV is secure. Tachygram is on. The flow of this IV is clamped, or of my tubing is clamped. And then through this entire time, I was assessing with my patient, making sure that they are not in any pain, and there's no infiltration at their site, allowing these time to dry. There doesn't appear to be any adverse reactions at the site or from my patient.
Steak only for you, little buddy. Cat only diet.
This tape isn't sticking. Okay.
I think that age does more harm than good.
Okay. And at this time, I would label the IV site with the date, time, the gauge size, my initials. My gloves. I would still be assessing with my patient, making sure they're comfortable, not in any pain. Then I will set this flow rate as ordered and open my tubing. At this time, I would clean up all of my supplies, assess with my patient one more time, record and report, and then come back to evaluate later.